All right. Good afternoon, everybody. Hope you're doing well. We're just going to give a couple more minutes. We know a few more people are coming on and joining us. It is a beautiful day here in Washington, D.C. I hope that it is enjoyable where you are as well. It makes us think about summer and the fact that National Health Center Week is quickly approaching, right? All right. So this is a webinar, which means that you won't be able to come off mute, but we do hope that you'll use the chat feature to ask questions, put your comments in, because we want to make sure that we are as responsive as possible to you and your interest. Also, for those of you who are already here, throughout the webinar, we're going to be talking about different programs and ways for you to be involved, because we hope that you will be working with you and among your teams to think about being advocates year-round. National Health Center Week is a great way to get lots of people inspired and excited. Absolutely, Christine. We want to keep people inspired year-round because we've got a lot that we're going to talk about today. We need advocates to stand up and work with us, stay with us. So anyway, just look for those ways to get involved and opportunities you might share with other people. I'm going to wait one more minute just because there's still people coming in. I appreciate everybody who's here and certainly want to make good use of your time. So we'll go ahead and I'm going to go ahead and start now because this other information we'll get to again. So one of the things you'll notice, the mission and pride, we want to make sure that National Health Center Week and everything we're doing is focused on our mission and that we are explicit about that. And the other thing that I really appreciate about this year's theme rather, is that we always want to celebrate our mission, want to celebrate the work and the creative work that health centers are doing, but wanted just to be explicit that today we're going to talk about a lot that we have to be proud of and want that to frame what we do every day and how we celebrate this week. So our team, and there will be one new staff person joining us at the beginning of June. But today you'll hear from me, from Sarah Francois, our Deputy Director, and Jennifer Turner, who's our Manager of Advocacy, Communications, and Engagement. This year's theme, y'all, we're super excited. We hope that you're going to join us on a road trip to celebrate community health centers. What we know is that community health centers, because we serve 30+ million people, that we absolutely make our community stronger, both in terms of how we serve patients and keep people healthy, in terms of creation of jobs and in generating revenue. Also want to have deep appreciation for our sponsors, and they are listed here. Athena Health is our gold sponsor, Satine, Community Health Ventures, eClinical Works, Orvis, McKesson, NextGen, Ochin, and United Healthcare. And so when any of them stop by your health center, if you see reps from them, if you'll just thank them for sponsoring National Health Center Week, it gives us the opportunity to be more creative and to celebrate all the work you're doing every day. So one of the things that's happening at NAC is that we have begun an organizing initiative. Rachel Gonzalez-Hanson, our interim CEO and president, was part of, when she was an executive director of the health center in Uvalde, she did this training with the Texas Association of Community Health Centers and thought it would be really important. We know that fatigue and despair are very much part of what's happening in our health center spaces. And that was before COVID, but COVID definitely exacerbated it. And one of the things about organizing, and this definition here speaks to that, is organizing is a type of leadership where we are working with one another to make sure that we're taking the people that we're in relationship with every day, equipping us, right, each other, with our power, and identifying that both in terms of story and how we celebrate and talk about the work we do every day, but also strategy to get the outcomes we want. And so I think it's really important. We talk about being rooted in the civil rights movement, but I think it's particularly important to understand a couple of things. One is that you'll see in these images, the first migrant health clinics were passed, the legislation for that was passed in 1962. And then the civil rights movement, there were two health centers in Boston and in Mississippi that grew out of the Freedom Ride movement because people realized people didn't have access to healthcare. So when we look at this, I hope that you'll look at these images and notice that it's not just one great person that we're talking about here, that there are throngs of people, there were throngs of people who are involved in organizing for migrant health rights and for civil rights, and many movements beyond that, that we want this energy to be with community health centers as well. And so today's conversation is going to be framed through the lens of community organizing because we want to continue building. So this is my mea culpa, right? This is something that when I participated in this training, I learned about myself, is that I, as a trained educator, right, I would raise awareness. I wanted folks to understand what health centers did. I also wanted health centers to know what was on the line and for advocates to stand up for health centers, because we do so much. We're so important to our communities, and everybody should know about us, right? This idea that health centers are this hidden jewel. We cannot be a hidden jewel if we're going to survive and thrive in the environment that we're in right now in terms of everything that's happening with respect to federal budget. So we would spend a lot of time raising awareness. Well, I want to kind of talk to you a little bit now about the organizing cycle and what that looks like, and then back to how we're doing things differently now. So organizing means, one, that we're encouraging people to become more conscious, to understand what's going on, to raise awareness. And then we're working to build power. We want to make sure that people are rooted in relationships. And so again, back to those images on the previous slide, that it wasn't just one or two people who were leading these movements that were up on Capitol Hill trying to get lawmakers to change certain policies or to make things better for their community. There were lots and lots of people involved based on the skills and the resources they embodied, and they have, right? And then after building power, we deploy power, which is engaging members of Congress, engaging other stakeholders, leaders in the community to get what you need to serve your patients well, right? And then we're in this work because we want to win, and we believe we're going to win because we know we have to win because the people we serve count on us. Well, remember when I said to you what I used to do, right? I was so focused on raising awareness and saying, this is what's happening. Please contact your member of Congress. Please sign other people up to be advocates. But if you notice, that invitation is very transactional. And I imagine there are many of you, and this is true of lots of places I've been recently where I've been in conversation with folks around the country, that you have told us that you've been tired of getting our emails, right? And part of that is because if we raise awareness and deploy power, raise awareness and deploy power, where do you go after a while when we haven't won, right? Or for many of you who said, why do we have to go back and ask Congress for funding every year? Don't they understand how important we are? And part of that's how Congress works in terms of funding being passed every year. And part of that is that there's some years where we want long-term funding and it's up for renewal. And that's the year we're in right now. My hope is that what you will see from our team and what you will see throughout the country, because there were 49 states plus Puerto Rico who joined us at this organizing training in January, is that you'll see us more invested in building power so that when we don't automatically win, there's a place to go back and rest, right? That we have community, we have one another, so that we can continue to share stories and be inspired by one another. And that ultimately we'll win, right? We're gonna win. Now, this is important to me, and I think this is something that we talk about with organizing as well, that I am with you all today because I was born into a family that had access to healthcare. And so my parents were social justice advocates. My mom was a farm worker nurse and ran a program in North Carolina. But when I was 15 years old and had my first seizure, my parents were worried and they wanted to make sure that I was going to be able to function, right? The way they had dreamed of me functioning in society and contributing to the world to make it a better place, right? That was their dream for me. And thankfully, my father was a federal employee. We had access to health insurance. And so I had the care I needed and have pretty much been seizure free. When you fast forward to the year that Senate was trying to repeal the Affordable Care Act, I was working with United Methodist Church and was heard about a pastor who was walking from his local church in North Carolina, not far from where I grew up, to Washington, D.C., because he was concerned that his daughter, Lauren Faith, who was dependent 100% on Medicaid, his family is small business owner, local pastor, so without Medicaid, she wouldn't have care. He walked from North Carolina and his wife and daughter joined him. And it was my responsibility that week to accompany them to every office of the North Carolina delegation, and also lots of other members of Congress to ask them to protect Medicaid for law and faith. It was through that experience of being with parents who are absolutely committed to making sure their daughter lived, right? She is confined to a wheelchair. She uses a feeding tube, and she's the same age as my oldest child, right? That work is what led me to say, and that I believe that everybody should have access to quality, affordable care. I think that's something that all of us on this call today share, right? That commitment to the mission of health centers. It's possible that there are lots of folks in your health center that believe that and share that share those same values, but may not say that explicitly. And so part of what we're doing in this process is encouraging people to begin sharing that explicitly, and so that we can know that we're standing together. So we do have that community, that purple slice of this organizing cycle, that place to rest, right? As I've spent time with different folks, health center leaders around the country, that is one thing I've heard. When we start sharing our whys, why we're part of this movement, the room becomes electric, right? It's a buzz because we are rooted in that space and we're not so focused on the challenges that we have providing care to folks every day. So when you think about this organizing cycle, we hope that you will think about how do you become a leader of leaders so that anyone you ask to invite with you to join in National Health Center Weekend, that celebration, you'll also be thinking about the potential leadership that they have in themselves to support you in this movement. So one of the questions I ask a lot is, and just ask you to reflect on this, how many of you feel like sometimes the things you care about aren't shared by a lot of other people and that it feels really out of reach, right? Certainly, this is something that I think about all the time. There's so many things that I care about don't seem to be valued by other people. And so it can be pretty overwhelming. And also I can get discouraged. And although I am 6 feet tall, there were certainly times when I was growing up where I was on a seesaw and my feet couldn't touch the ground. And sometimes I can be helpless, especially if you have an older cousin who is trying to scare you a little bit, right? So one of the things about health centers that I love and greatly appreciate is the work that all of us have done together to balance power. We have bipartisan support, and my colleague Joe Dunn talks about how easy it is to talk about health centers on Capitol Hill because it's like selling apple pie, right? Everybody loves health centers, and we know that because of all the care that you provide, all the work we've done, and the impact we make in our communities. You notice still, though, that it doesn't mean we're going to get the funding we need, or it doesn't mean that we're going to get the protection for 340B that we need, and so we need to continue our efforts to shift power, right? How do we bring more people in the movement so that we can tip those scales and have this work out in our favor? And this is beginning to happen, but it takes persistence. When we think about leadership, remember I mentioned that organizing is a type of leadership. There are some organizations where there's one person in leadership and people respond to that person, and that is certainly a model of leadership that can get certain things done. Right? There are also folks that reject that model and go the opposite way. Say, you know what, I do not like that micromanaging methodology, whatever it is, it feels gross to me. I think we should have everybody do their own thing, and we'll just come back together when we need to. Again, also works for some organizations. Collaborative leadership is when there's a core group that is working together to make sure that work is, and I see this a lot and hear about this a lot at health centers, right? You know that people's work is coordinated. There's not a lot of duplication of effort. And if you need some assistance, there's someone to step in because they understand enough of what you're doing that they can help you with that. Also a really effective method. The difference with organizing and leadership is that in addition to that core group of leaders, we want to invite exponentially more and more leaders, right? So as we invite people in, that core leadership team would be looking for additional people who can help them lead. So for example, I was in Kentucky facilitating organizing training last year with the state PCA, and there was a health center there. The CEO had been part of a training as well as a board member. They brought a total of 9 people from the health center, frontline staff, nurses, school-based clinic staff, right? And so it's really important to think about. There are lots of leaders in your health center who can make this exponential and can bring others into the conversation. And so that's our goal for organizing. It's really important. So I shared with you, and I'm talking kind of quickly, and my colleagues aren't here to slow me down. So if it's too quickly, please, please, please come off and let me know. But I get really excited about this as well. What I love about hearing people share their whys, whether it's board members or staff or longtime patients, is the interest and the values that we share. That as soon as we start telling our why, and as soon as we start talking about our commitment to healthcare or serving people in medically underserved communities or addressing health inequity, right? Creating health equity, that we begin to form a deeper relationship. Every time I have one of these conversations, it makes me want to get the person I'm having this conversation, it wants me to get to know them better, right? Because I then begin to see that there's something we share, and because we're together, we are stronger. And that sounds like a cliche, but I deeply believe it because it means that I'm not alone. And so I think so often when we care for people who are vulnerable, when we care for people who are marginalized, that's not necessarily shared by people in our communities. And it's really important that we remember that we want to build communities so we can share with one another. Now, one of the things you'll notice is as we talk about these shared interests and resources and values, there's also this bond right across the top, which is the commitment, that we become committed to one another. And so again, the grassroots advocacy team here at NAC is working to make sure that as we encourage you to deploy power, to use your power to stand up for health centers, that we're also working to build community and to nurture that, to be connected to you so that you know that you're not alone, that you know that if you need support in terms of building community, building a community of advocates, a culture of advocacy at your health center, that we're here to support you with that as well. So our goals for National Health Center Week are to do these three things. We're going to celebrate health centers and all the innovative things you do every day. We're not, because again, if we root ourselves in the mission, we are reminded that we are not just another healthcare provider, right? And we need to make sure that everybody understands that. We're going to increase community awareness and buy-in. And then we're also going to advocate for sustainable funding and policies. So those are the three things. We're going to make sure that you have the resources you need to accomplish these three things. Now, this year, I mentioned this a little bit, we have health center funding that is up, both the annual funding that we work toward every year, and then also the long-term funding, that both of those things we're working on right now with our legislators. And thank you all for those of you who are involved in this as well. Protecting the 340B pharmacy discount program, which we know is much more than that because the savings you use to create all kinds of wraparound programs then increases access to the care that you provide, and then workforce challenges. These are the three things we're focused on. We don't want anyone to think that they need to be a policy wonk to stay up to date, right? If you're signed up for the Washington Update or Action Alerts, we'll let you know the most important times to take action so that you don't have to be preoccupied with this. We can carry that for you or with you. But we do want to make sure that folks feel inspired and feel capable, right? That you feel not capable because everyone's capable, but you feel equipped to share your why. You feel equipped to stand up to make sure that the things you care about are being heard with your elected officials. So let's talk a bit about where we are. Like I said earlier, if you think about that seesaw, we have long-term bipartisan support. The other thing, though, is that seesaw can easily start tipping the other way, away from our what's needed for us, because folks are tired, right? You're wearing many hats. There may not be a person dedicated to communications or to advocacy in your health center. You may feel like you're doing this by yourself. And again, like I said, we want to build community, and we want to work with you to help identify other people in your space, in your organization, in your board, in your community that can support you in celebrating what you do every year and then growing that beyond. Pushing the seesaw down again in our favor, President Biden, the Biden administration, HRSA, all the folks we hear from on a regular basis, are saying that they want to invest to double the funding for community health centers because they know what all you are doing, right? They know that it's essential and important. And we also know there's still millions of people in our country that don't have access to care. And so there are lots of places where it would be great to have a new access point, and it would be great to have other money to invest in new programs where you want to expand services. So there are lots of things that we want to do, and the administration wants to do that, wants to provide that funding. But we know that the administration can't provide that funding if Congress doesn't want to. So we've got folks in Congress who are concerned about overspending and don't want to spend money, don't even want to say that there's going to be 5 years long term. We do know at this point that the committee that's in charge of funding has said 2 years. And that's good because it means that we don't have to go back year after year after year after year for funding. That there's some dedicated funding for that period of time, but it's not over. We've got a ways to go in terms of getting this legislation passed through the entire Congress. So we hope you'll stand with us in that. So in this time, right, we've talked about how we're coming to this work, what's at stake for us during Community Health Center Week, but also what the opportunities are, right? This is an opportunity for us not only to celebrate during this 1 week, but to say community health centers are essential for every single community where we are located. And we want you to know why. We want you to know why we're passionate about the work that we do. We want you to know why we are essential to the quality of life in our community. So let's get to it. Nova, I think you're taking over.
Okay, hey everybody, I'm Jennifer. I'm the manager of communications and engagement with the advocacy team at NAC. And I'm really excited to be going over the next couple of slides with you guys. So to start off with, we're going to look at the kind of calendar of events for a summer of building power. We just heard from Susan about the importance of building power and some tools in doing that, and really the importance of community in that. So starting in June, we're going to be kicking off a social media campaign. Also in June 30th is the deadline to submit your events. So from the slides that you have access to, you can click on the submit events and I'll take you to the website to submit your event or multiple events if you have those. And then in July, we have a Citizens Advocate webinar through the Congressional Management Foundation with the registration link for that. And if you just love this webinar and you want to attend it again, or you want to invite some colleagues or friends to attend the next one, for the final prep webinar is July 20th. And then August, is the main event for National Health Center Week, August 6th through the 12th. And so as the communications manager, I absolutely love a great organized collaboration of a social media campaign. So in the weeks leading up to the National Health Center Week road trip to a Stronger America, we are going to be spotlighting and celebrating 2 states and/or territories each day. And so here is a sample for Indiana of what it'll look like. It'll have some fun facts, some interesting facts, really highlighting the great work that's being done, and an opportunity for you guys to shout out your states, really represent how your community health centers and your communities are adding to your state, enhancing the lives of people that live in your states. So get creative on social media, rep your state, get creative with the theme, use the roadmap of your health center, your community, your state, an endless opportunity to be creative there. And if you want to know when your state is going to be highlighted on our social media roadmap, you can click on that road trip calendar. It has already mapped out when each state is going to be highlighted on our Twitter and Facebook accounts. And so please definitely follow us and share, like, and comment on all of those great things. And I'm currently putting together these social media posts right now, getting them planned and mapped out. And I can tell you that there are some phenomenal things happening across the country that we're really excited to be highlighting throughout this couple of weeks leading up to National Health Center Week. Okay, so next slide. And as always, we have the focus days during National Health Center Week that really focus on social determinants of health and addressing health equity issues that can be woven into the theme. And you can use these different days throughout the week for your events and different things to highlight the different groups and issues that are really pertinent to community health centers that can bring awareness and also highlight the successes that everybody's been achieving this year. Okay, next slide. And our website, the National Health Center Week website, is live and updated. So definitely check that out. From this website, you can get information about the sponsors. You can find information about the focus days, register your events, find other events in your areas. You can check out the National Health Center Week store. So you can buy all kinds of really fun, creative merchandise to go along with the theme. And because everybody loves a good road trip, in my opinion, the best thing about a road trip is the playlist. And so we have a playlist that is currently being curated specifically to be focused on taking the best road trip across America possible. So definitely check out the website for that playlist coming very soon to the website. Okay, and I'll turn it over to Sarah.
Thanks, Jennifer. Good afternoon, everybody. Happy to be here. My name is Sarah Francois. I am the Deputy Director of Grassroots Advocacy here at NAC, coming up on my 1-year anniversary here. And prior to that, I actually did work at a health center in Milwaukee, Wisconsin for about 15 years. And so I was very active in helping plan National Health Center Week events at my health center. And so this is one of my favorite topics, one of my favorite times of year to just be able to share. And I love all the sharing that's happening in the chat. It's great. You don't have to come up with all these ideas on your own. You can share resources and ideas and make them unique to your own community. So definitely keep sharing that. I think kind of building off of what Susan was speaking about, and then also talking about some of those resources that Jennifer mentioned, it's all about bringing those things together, right? And so I think when you're looking at planning activities for National Health Center Week, everything we use literally this year is kind of a roadmap. But we know that you might take your own path to get there and utilize some resources differently than others. But I think the main goal that you should always be looking at when you're planning these types of events is really speaking to those relational relationships, like building those relationships versus transactional relationships. So the transactional is just like, hey, I want something from you. Or your patients might need something from you, or you might need something from an elected official. But I think it's more about building those relationships together. And that's where you create and you discover a lot of those shared values and interests. So definitely create a plan for yourself, right? And I think that starts by developing a leadership team. Likely you might be one person from your organization on this webinar, and it is highly unlikely that you are going to be able to do all this work by yourself. So kind of pull those people together that you think can collaborate with you, that might have some time and some creative ideas that can help pull this off. Definitely you're going to need buy-in, of course, from your leadership, sometimes even your board. So be sure to kind of think about that. And that's why we're hosting this webinar now, even a few months in advance, because it does take time, right, to be able to plan these and really implement them. Then when you're looking at the activities that you're hoping to plan, we have those focus days that Jennifer just mentioned to kind of give you some ideas. And on our website, on each one of those focus days, you will be able to see some ideas that we have sort of generated that you might want to consider for celebrating those days. By no means do you have to celebrate every single day. Right? So pick and choose what works best for you, but also what's going to help you achieve your strategic goal for what you want National Health Center Week to be in really building those relationships. And that leads us into that second point there. This is all about relationships, right? Everything we do at community health centers is about relationship building. And so I think that's at the core of the mission. And so hopefully this should be an easy one for you. And I'm thinking a lot of you already do many of these things already, but think about partnering with local organizations. Again, don't assume that you have to do it all by yourself. At my health center, we had a site that was in a housing authority building. And so we partnered with the local housing authority and hosted an event with them. And they helped us get some vendors that were also from the neighborhood. So we didn't have to do it all by ourselves. Think about people that you're already working with in your organization and how they might be able to help you bring this together. Definitely be sure to invite your elected officials, and we'll be talking about that in a couple of slides, but that's certainly an important point. They are on recess typically on the federal level in August, and so that's a great time that they should be in your state, and they will hopefully be coming to visit your health center as you invite them. Sponsorship support. So it costs money, right, to do a lot of these things and have activities. But remember that sponsorship can come in a lot of different forms. So you could be seeking maybe in-kind donations from a local business. Maybe they're willing to provide lunch. Maybe a local cafe is willing to provide lunch for your staff for Staff Appreciation Day, or maybe a bakery. We had a bakery one year that made cupcakes for our staff, just because they really wanted to get involved, and that was something that they were able to do. Volunteers also count as that support. It takes a lot of people to pull off events like this. In addition, sometimes local health systems are interested in getting involved, in hospitals. If you partner with those, they typically have larger budgets to do these type of events than you might. And so that's a great resource as well. And definitely don't forget about the media. So earned media is great here. Media is always looking for feel-good stories, and health centers are full of those feel-good stories. So this is a perfect time to pitch your idea or pitch a story from your health center and look at getting engagement from your local media resources. And you definitely want to have a communications plan of your own to determine what's your messaging going to be that leads back to those strategic goals. How are you going to get those people engaged? How often are you going to communicate with them? You want to be sure that you're providing continual updates and making sure that everybody who needs to be aware of what's going on is. And this is a great opportunity to get your staff involved. Staff loves National Health Center Week. And a lot of times they don't really realize the importance of community health centers until National Health Center Week comes along and they realize that there's so many opportunities to become involved and have fun. So definitely have fun with it, have a plan. And of course, follow up. You're going to be wanting to thank anybody who's helping you support this event. Thank yous go a long way. Pictures with thank yous go a really long way. So be sure to provide those updates. I always used to send out an all staff email that said, this is how many people showed up at our events. This is how many new people we were able to attract. This is how many people donated blood in our blood drive. We used to host a blood drive as well as part of National Health Center Week. And that just generated a lot of buzz and feel goodness in the health center, which was awesome. And always continue to invite people to lead with you. Of course, here we're all about grassroots advocacy and kind of building your network. And I think you're going to find that as you're planning National Health Center Week events, you might find people that are more interested in advocacy than you might have thought before. And so there's always new opportunities to get involved. And this is a good time to get people started. Next slide, please. So we definitely want to have you share your event with us. So on our website, there is a link. So as you guys are starting to plan events, we already saw that there's a few on there, which is great. We want you to keep posting those events. This is really important. And I think a lot of people are like, do we have to put in all the information? And yes, we like as much information as possible for a couple different reasons. Number one, it helps us know what you're doing. Number two, a lot of times we'll get corporate partners and things like that who are interested in knowing what's going on in certain communities, in certain states that they might support. And also, as it comes time to work with our elected officials, we're going to kind of know who's where and in terms of members of Congress, and can kind of figure out what events might be best for them to come and attend and other things. So definitely post those events because we do use that information. We do share it with our partners. And it's a great way to also get some additional recognition and publicity that way as well. Next slide, please. We talk a lot about do's and don'ts, right? When it comes to working with elected officials, doing a lot of activities around National Health Center Week, whether it's voter registration and other things, which we'll get to in just a second. You know, a lot of you have probably seen this slide before if you've been to any of our other webinars, and it's pretty straightforward, but you know, clarifying your personal commitments versus your organizational ones. So we definitely want to keep things separate. You know, as we're posting things on social media, we want to be sure that as you're tagging members of Congress and other things, you're not necessarily doing that from your personal standpoint while you're also on work time, right? Because you definitely don't want to meld any of that. Of course, all of you receive federal funding, and we certainly want to be sure that we remain nonpartisan. Nonpartisan should probably be number one on that list, to be honest with you. And we never want to make it appear that we are favoring a political party over another, or a specific candidate or anything like that. So definitely be sure to keep those separate. And we have additional resources that can help you kind of define these. If you are interested, maybe one of my colleagues can put our grassroots advocacy email in the chat so that you can reach out to us, because we have whole presentations on best practices that have been vetted by our legal team, and we are happy to share those with you. But the main ones: remaining nonpartisan, booking a small percentage of staff time with non-grant funds, right? And so I think this is a biggie. Do you use your entire Section 330 grant for staff resources? If that's the case, hopefully there's no staff that is booked 100% on that federal grant. And that's because if they're booked 100% on the federal grant, it's going to be a little bit harder for them to engage in some of these activities. And that's where we start to blur some of those lines. But even leaving 5% booked in from another source will allow you to do some of this civic engagement work. There's always opportunities to create policies, again, for staff and volunteers, and for your board to also have a formal resolution to say that what type of work is allowable and what is not. Next slide, please. There we go. So this is one of my favorite topics because I was very involved with Vote ER, and I think we're missing a couple of bullet points here still. Yeah, there we go. I was very involved with voter registration during my time at the health center, and loved working with Vote ER. I know many of your health centers are doing voter registration activities already and might already be a Vote ER partner. It just so happens that August is not only National Health Center Week month, but it's also Civic Health Month. And so that is a great time to really promote voter registration and civic engagement activities. And these are all the things that health centers can do. You are allowed to register voters as long as you do it in a nonpartisan way. So again, we're not, saying candidate A is better than candidate B. We're saying, hey, are you registered to vote? If not, let me help you do that. Right. So some people have voter registration tables out in their lobbies during National Health Center Week or at some of their events. Again, any staff that are staffing these tables, you want to be sure that they're using this on time that is not paid via grant funds, so that there's no blurred lines. You are even allowed to serve as a polling location. That is allowable. This has been vetted by our legal team and by HRSA, that health centers can serve as polling locations, and you're allowed to educate voters on issues. So, you can, a lot of election officials provide information that say, like, these are all the candidates in your area for this particular election, and this is where you can find more information about them. Those are the resources that you want to use, and Vote ER can help connect you to those resources. You can also host elected officials at your health center, invite them to come. You just want to be sure that you're inviting all of them. So you're not just inviting the Democrat in your district or the Republican in your district, but you're inviting everybody to come. Not everyone might show up, but everybody needs to receive an invite, so it's not showing any partisan nature. Next slide, please. So again, inviting elected officials. This picture here is actually of me during National Health Center Week a couple of years ago. It just so happened that one of our state representatives, Evan Goyke, in the city of Milwaukee, was representing our district. He also sat on our board of directors at the health center. He was very actively engaged in advocacy, and we invited him. We presented him with a little award, which we have those templates available on our National Health Center Week website. And he had just had his son very recently. So he actually came to read with his son to Children for Children's Health Day at our health center, and as part of our Reach Out and Read program. Perfect way to get people involved, right? Elected officials actually love volunteering because volunteering usually leads to photo ops, and photo ops make for great publicity, right? So definitely opportunities to get involved. Be sure that you're working with your elected officials' offices as soon as possible. If you know that you want to host an event in August, send those dates and say, hey, is there opportunity to have official X, Y, or Z come? You need to be flexible. They might not be available on the Monday. Maybe they're available on the Wednesday. That's why you start having those conversations now, so that there can be some flexibility in there. You can see the different types of engagements that you can have with your elected officials. Awards are always great. If they know they're going to get an award, if they know there's going to be a photo op, invite them for a tour. If you're having a grand opening, do a ribbon cutting. Anytime there's going to be media or cameras, you're going to have a much greater chance of getting elected officials to show up. You can also host candidate forums or panels. Again, just make sure that you're inviting everybody so that they all have the opportunity to join. And whenever you are tagging elected officials on social media or doing anything like that, you want to be sure that it's with their official account and not with their campaign account. Because again, you don't want to be associated with a political campaign. You want to be associated with the sitting elected official in your area. Next slide, please. I will very quickly talk about the Advocacy Center of Excellence program. I hope you've all heard of it. It's an awesome program that we have to recognize health centers that are really going above and beyond when it comes to advocacy and building it into their organizations as part of the culture of the health center. There's 3 different levels, which we'll talk about in just a second. But wanted to point out that we're in the midst of a 100 ACE challenge right now. Our goal is to reach 100 ACEs by National Health Center Week. We are currently at 77. I have 300 people on this call. I'm not quite sure how many health centers you represent, but I'm guessing it's probably more than 23. So I hope that if you're not already an Advocacy Center of Excellence, you might consider doing so. Nova, you can go to the next slide. It's becoming a bronze ACE is actually probably a lot easier than some people may think. You can see the requirements there to become a bronze, and National Health Center Week, hosting an event for National Health Center Week is one of them. You can check it off the list. Getting onto social media is another one. Check it off the list if that's something that you're doing. So we really hope that you will consider becoming an ACE. And if you're interested in finding out how many of your staff and board members are registered as advocates, please email. You can either email me directly, somebody can put my email in the chat, or that grassroots email, and we'll be able to get you that information as well. Next slide, please. This is where I hand it back to Susan. Thank you so much.
Hey, great. Thanks, team. I hope that you all are committed to helping Sarah, all of us really, but Sarah, reach the 100 ACEs by National Health Center Week. So one of the reasons that ACEs are really important is that when corporate sponsors reach out to us and they're interested in sponsoring National Health Center Week and they want to be connected to specific community health centers or particular markets, particular states, when we have a relationship with you, like we do with all the ACEs, because we're in regular communication, it's easier for us to identify you and connect you with those sponsors. It's when HRSA and other federal, state officials are going to make visits, they can go visit our website to see who's an ACE, to see who is engaged and connect with them. And then anytime anyone's asking me for recommendation, whether it is recommendations, whether it is related, whether there is a press request or whatever the case may be, with those relationships, we then can direct additional resources to you. So it's not the favoring of that, but it is that because we have the relationship and I know I can reach someone at your health center, it's an added bonus, I think, in addition to creating that culture of building those relationships. What I've heard from folks who are ACEs and from people who are really involved in building that culture of advocacy is that there is a way that the energy, that the commitment to the mission, the explicit discussion of the mission helps strengthen people's resolve to do the work they're doing in their health center, right? That it is about community. There are so many other things, factors, resources that come to play beyond financial, right? The financial absolutely matters. I'm not minimizing that. But in terms of quality of life, in terms of feeling good about your workplace, when you have the community, when you're gathering together around mission and vision and values, then there's another kind of strength and energy renewal that happens as a result of that. So you might think of it as a pit stop right along this road trip to make America's health center stronger, make America Health stronger. So NAC, in addition to corporate sponsors, NAC also gives sponsorships. We want to make sure that folks all over the country have access to this. So there are 3 criteria. One, you need to make sure that you are hosting a community-wide event, that you are engaging folks on social media, helping them understand why you're important, why you're essential to your community, and that you're inviting elected officials. So National Health Center was started to occur in August. The date is planned because elected officials from Washington, D.C. are on recess. And so they're going to be at home in their districts and their states. And so this is an optimal time for them to visit you and spend time with you. So those are the three criteria. You need to have listed as much information as you have on the Grassroots Advocacy website, the National Health Center Week website, healthcenterweek.org, by June 30th to be considered for this. We understand that it takes a while, and often it's right before National Health Center Week, before elected officials confirm. The confirmation isn't important. It's the fact that you are sending those invitations out. And there are sample templates. We are in the process of updating them right now, but there will be a sample invite for members of Congress on the website. Next slide, please. All right. So I don't know how many of you are spending time on social media. I always did. I also live with a teenager and a young adult who spend a whole lot of time on social media, more than I actually wish they did. The other thing we know, though, is that elected officials are on social media, that you can reach your elected officials every single day. You can remind them every day of why your health center is vital to your community by sharing something on your social media feed, whether it's Twitter or Instagram or Facebook, LinkedIn, about why, what your health center is doing, and tagging your elected officials. That's really important. And again, you don't have to wait for National Health Center Week to do that. The member of Congress, the state House representative member, does not have to be present with you. You can just put in there, just want you to know what we're up to, right? Thank you for your continued support. Whatever the message is you want to put with it. But we hope that you will use National Health Center Week as a way to get other people at your health center involved, community members involved, et cetera, and amplifying your voice and their voice in health centers every day. So HC Advocacy is the handle that we have, and so we ask that you would follow us and amplify what you see there. For National Health Center Week, we'll be using hashtag NHCW23 and hashtag ValueCHCs. And if you need, we have a list of elected officials' Twitter handles that we will also put on the website. So if you don't know what those are, you can easily find them. Next slide, please. All right, so I mentioned a number of things already. These are examples. The playlist link is in the chat, and you can go to NAC's Spotify account and find the playlist there. There are certificates of recognition. There are a number of different templates that you can use if you do have elected officials visiting. Sarah already mentioned a number of resources that are available. A couple that we haven't talked about yet, there is going to be a video contest, and there's also going to be road trip bingo. So those will be available for you to engage your staff. We're very excited about those. And then the social media graphics will be coming out, and you've seen the link to the calendar there. We are going to put fact sheets on there. What you may not know is that National Health Center Week is the time when the federal government releases the data, the new UDS data about patients that were served in 2022. So the current fact sheets and everything that's there reflect the numbers from last year, but those will be updated right before National Health Center Week as soon as we get the go ahead to make that data public. And then this webinar will also be posted on the website. Next slide, please. Okay, so you can tell that not only have we been having a good time with the logo and all the creativity Jennifer's put into this, but our store, the National Health Center Week store, and the team that runs this for us has as well. So you'll see coloring books. I love the car flag. You see the floor stickers. So there are all kinds of things you can order from them. If you are interested in doing something specific to your health center, they are more than happy to add your logo to whatever it is that you're promoting. There have been some folks who said that you didn't want to put the year on the T-shirt or the bag because you want it to last beyond the year, and they're totally open to that. So we encourage you to reach out to them so that you can get the resources you need to make Health Center Week as festive as possible. Next slide, please. All right. So one of the things that we know. Go ahead, Noah, please. Thank you. There should be one more. Thanks. We know that our job is to build power and protect access to 30+ million people. We absolutely know that. You do this every day. You're committed to doing this every day. And our team wants to support you in doing that as best we can. We believe deeply that National Health Center Week is a reminder that advocacy, that standing up for people that not everybody wants to stand for, that caring for our communities, for investing in our communities, for sharing these values, for investing in this way of being is something that can be life-giving, celebratory, and fun. And so we want to make sure that you feel like you have what's needed to build power, to shift power, and become a leader of leaders as you're planning your National Health Center Week events. Next slide, please, Nova. 3 ways for you to get involved year-round. And again, this isn't a just National Health Center Week thing. It's a time to bring people together and to continue building on that momentum. So sign up for an advocate. There's resources that Jennifer already put in the chat, and then the Retweet of the Week initiative. Next slide. And then the final webinar will be right before National Health Center Week. So if there are other people you want to join, we will have additional information to share that time. We'll have talking points and other things ready, updated based on where we are, because if you have elected officials and other stakeholders visiting your health center during National Health Center Week, we want you to feel, like I said, equipped to engage them. But remember, because of your passion, because of your commitment, your why for serving health centers, what brings you to this place is powerful. And so we want you to rest in that, use that to bring other people into the movement, to join, encourage, invite other people to join you in leadership. So please let us know what we can do to support you. Next slide, please.
I think that's it, Susan.
All right.
If you have questions for us, probably the easiest way is to place them in the Q&A, and then we will address them there. And Kathleen, yes, we will put the slides in the chat again. We do have that link.
So I see a question from Nancy in the Q&A. This asks how people are localizing the theme. I think about things that are unique to your community. So I could either think about where I grew up in North Carolina, where I live now in Washington, D.C. When I took road trips growing up, usually they were to South Georgia, where my grandparents live. And so I am visioning all the things. I'm visioning peaches. I'm envisioning boiled peanuts on the side of the road. I'm envisioning those peanut logs. What is it that will make this come alive for your community? And for some reason, I'm very focused on food, as you can tell. But what is it that comes to life, that brings your health center to life for people? This is an opportunity for you to expand on what you do every day. So the graphics for your particular state are going to be there, and you can use that to amplify it, and you can use that data on the particular day you're celebrating. But it also might be a great way to engage your staff in thinking about the mission of the health center. How do they see it strengthening their communities? What is it that's unique in your community that people would find if they stopped by? I'm hoping that no matter where you are situated in continental US or Alaska or Guam or Puerto Rico or Hawaii or everywhere else, that you see what is unique to you and what is unique to your community, so that we're all learning about what you do and how you creatively and innovatively respond to what's happening in your community. I hope that's helpful, Nancy. I wish I knew where you were, and then I could brainstorm with you here. But I think, so there are some sample lists. I love those. Blood draw, read to kids, voter registration. There are a number of people, because it's August, that will do back to school physicals, so they'll have a focus on children. We do have a partnership with Sesame Street, and so you'll see some things with Sesame Street come up on that Saturday. There are a number of things that we can do. And I think the other thing to think about is, who are the community partners, right? Is there a local library that you might involve with you, so that more people get involved in this, and that you can use community spaces to promote and expand what you do and how you do it? Who are the community leaders who are that you'd want to celebrate in this time to support you? Sarah, I don't know. There used to be a place on the website for opportunities or suggestions. We can come up with a list. And we
Yeah,
can think about a
so
way to share those.
on each one of the focus days, you'll see like there's little bullet points that says consider celebrating with these various activities. And so there are some options there. Well, I can also create a little bit more of a centralized list on the activities and events page. Another one that I've seen a lot of people do is community cleanups, or planting community gardens is another great one. You know, children's events are always really free haircuts. So we used to have a local barber come and do free haircuts as part of the back to school. So I think there's lots of different ways that you can get involved with a theme and other things and get involved with community partners, but we'll continue to update that activities and events ideas lists on the website as well.
And Nancy, you know, thinking about what's in Central Texas, road trip bingo might be something that you could engage your staff in doing. You could create one that's central to your community, and we can provide that template based on what the other one that's being created for nationally. It is an opportunity. I think, you know, when we think about reaching decision makers, they all have pride, right? We all have pride in the place we live. And so we want to build on that. And again, I saw some comments about what makes how we discuss strength. And I think it's really important for all lawmakers to understand that without community health centers, our communities wouldn't be as strong as they are, because if we're not healthy, we can't be strong. The economies can't be strong. And so we want to be very, as we talk about this in relationships, we want to be really explicit about this, that health centers are essential to our communities. And we need to make sure that Congress understands that their partnership has been great, and we need them to continue partnering with us so that we don't have, there's no question about whether or not we're going to get the funding we need to serve, to continue serving all the patients we are serving. Any other questions?
That's it with the Q&A in the chat.
Yeah. There are, you know, the last thing I'd say, everybody, is that when I talk with the sponsors, certainly I'm talking about the workforce challenges and fatigue that you all are very familiar with. And so I encourage you to also to find some ways to invest in celebrating your staff, celebrating your team, creating space for them to talk about why they're there, what's meaningful to them. One of the people who participated in our training in January said, sometimes we just sit down and to do business and we forget to talk about why we're here. And that may be something that all of us can be more intentional about as we work our way towards National Health Center Week. Thank you all so much for what you do every day. Incredibly grateful for each one of you. We hope that we will see you, if not in person, virtually, but please feel free to reach out to us because we want to support you in this work. And we want to do as much as we can to build relational power so that we continue to be fed and nurtured to be sustained on this journey. Thank y'all.